the lab leak theory, the effectiveness of masks, and vaccinated people spreading COVID. That and more things we were banned from saying, but now we can. Welcome to America Uncovered. I'm Chris Chappell. Oh, hello again, COVID-19 misinformation warning label. Over the past 2 years covering the coronavirus pandemic, I've been so used to having the COVID warning label under my chin, I'm thinking of making it into a platinum chain necklace I can wear like a rapper. Of course, it'd be hard for me to afford that since I've been routinely demonetized starting in 2020 for saying outlandish, conspiratorial, and downright despicable things the many experts in 2022 are now saying have been true all along. A lot of the narratives around COVID-19 have gone from fringe to mainstream in less than 2 years. COVID conspiracy theories are kind of like TikTok videos. A few years ago, anyone sharing them was considered a childish outcast who spent too much time on the internet, but now TikTok videos are even being shared by doctors. What sort of controversial things am I talking about? Let's count them down, starting with number 6. The idea that COVID came from a lab in Wuhan, China, used to be considered a fringe theory. Fringe theory is actually the exact phrase used by the New York Times in February of 2020, when Senator Tom Cotton suggested it. Cotton's exact words were, "We don't have evidence that this disease originated there, but because of China's duplicity and dishonesty from the beginning, we need to at least ask the question to see what the evidence says. And China right now is not giving evidence on that question at all." This article, and many like it, said this type of theory was only spread by people who saw China as a threat. To be fair, not seeing China as at least a little threatening is a theory I'd argue ought to be fringe. That's like saying, sure, that panther over there has been staring at us, pacing back and forth and licking its chops for hours, but I don't think it's a threat. Let's all let our guard down and take a nap. So the New York Times essentially said we had nothing to fear when it came to the lab leak. Which is surprising since peddling fear is what the media does. The media telling you to not be afraid is like KFC telling you to go for a jog instead of getting extra biscuits and mashed potatoes. But fast forward 21 months and the New York Times put out an article saying we should all be afraid of the next lab leak. They don't fully admit they think the theory is plausible, saying COVID might not have come out of a medical research lab, but it raises some urgent questions about how those facilities operate. So they're saying we don't know if that's true or not, but we should be afraid anyway. Yep, that's the high-quality fear the media is known for. It's not just the media backpedaling. The Biden administration now sees this theory as credible. And new clues are still emerging as recently as last week, pointing to this conclusion. This theory has gone from conspiratorial to plausible to maybe even likely, even from people about to be mauled by a panther. More after the break. Welcome back. Number 5. In March 2020, Dr. Fauci had this to say about masks.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask.
No reason? What if you need to conceal your identity so your enemies don't go after your loved ones? Be careful with your recommendations, Fauci. With great power comes great responsibility. Of course, that recommendation later changed, and everyone was encouraged to wear whatever they could over their faces. Some people got pretty creative, with DIY videos showing how you can turn your bra into a mask. So before getting mad at a guy for stealing one of your bras, remember, he's not a pervert. He's just trying to stop the spread. Many people still refuse to wear masks, with a lot of them saying that cloth masks won't actually protect you against contracting the virus. Anyone who made these claims was labeled selfish, childish, and a grandma killer. At least until the CDC admitted that they were correct, and cloth masks aren't that effective, especially when it came to more contagious variants such as Omicron. And the CDC recommended only wearing N95 masks. With all these mixed messages, are the people refusing to wear masks actually selfish, childish, and grandma killers, or are they just confused? Adding to the confusion, Fauci said you could just wear 2 masks instead of 1. So if you have a physical covering with 1 layer, you put another layer on, it just makes common sense that it likely would be more effective. So before getting mad at a guy for stealing 2 of your bras, remember, he's not a pervert, he's just practicing common sense. Number 4. A year or 2 ago, believing that COVID hospitalizations were being over-exaggerated was considered a conspiracy theory shared by kooks who weren't taking the pandemic seriously. Well, want to guess which medical professional proved this claim to be correct? I'll give you multiple choices. Was it A, Dr. Fauci? B, Dr. Fauci? C, it was Dr. Fauci, wasn't it? Or D, we know it was Fauci, just show us what he said. If a child goes in the hospital, they automatically get tested for COVID, and they get counted as a COVID hospitalized individual when in fact they may go in for a broken leg or appendicitis or something like that. So it's overcounting the number of children who are hospitalized with COVID as opposed to because of COVID. If you chose answers A, B, C, or D, then congratulations, you're a winner on America's least favorite game show, Who Wants to See the COVID Narrative Change Again? Number 3. If you said ivermectin might be an effective tool at combating COVID, people would ask why you're eating horse paste. And Howard Stern might mock you for taking horse dewormer. Of course, controversial broadcaster Howard Stern mocking controversial broadcaster Joe Rogan for making questionable decisions is kind of like the kettle calling the pot fart man. We heard constantly in the media how no doctor would ever recommend ivermectin in dealing with COVID. Except, of course, that some doctors called it a wonder drug. And there were claims that it greatly alleviated a majority of COVID cases in Delhi, India. And it could have saved millions of lives. Ivermectin has been and continues to be highly politicized. It's not 100% clear how effective ivermectin is or isn't when it comes to treating COVID. However, saying it's simply a horse dewormer is entirely inaccurate. Even CNN's top medical analyst, Sanjay Gupta, admitted to this on Joe Rogan's podcast. Ironically, they kept calling it horse dewormer because politically they had a horse in this race. Ruling out a possible COVID treatment over politics is not only ridiculous, it's unethical. You can't just rule out a drug without unbiased research. Except, of course, ecstasy, because any drug that makes you want to lick strangers' faces isn't going to treat COVID, it's going to spread it. Speaking of politicized drugs, after the break, I'll get into vaccines. Welcome back. Number 2. When the COVID vaccine first came out, it was considered blasphemous to say that you could still catch the virus if you were vaccinated. Even if you simply asked questions about the vaccine, some people would react as if you were describing how much tongue their mothers use while kissing. Here's what President Biden said.
Fully vaccinated people are at a very, very low risk of getting COVID-19.
And articles like this one came out saying it's official, vaccinated people don't transmit COVID-19. Well, it's not that official, it turns out, because COVID, especially Omicron, is not only able to infect, but also be spread by vaccinated individuals, even if they've gotten their booster shot. To be clear, technically no vaccine is 100% effective. And COVID vaccines do work at reducing the risk of severe illness and death if you do contract COVID. But telling people they can't question the effectiveness is like saying you can't question the science. The whole point of science is asking questions. Only someone who fundamentally doesn't understand science would say you can't question them.
As attacks on me, quite frankly, are attacks on science.
Wow. You know, maybe I'm being a bit harsh on Dr. Fauci. It turns out he's actually very consistent. Unfortunately, the only thing he's consistent about are making comments that wind up making him look terrible. When it comes to making all of the American public trust and listen to him, Fauci is about as effective as electric attacks on ground-type Pokemon. And if you weren't as cool as I was in high school, that means he's not very effective. Speaking of authority figures we weren't allowed to question, number 1. Remember the early days of the pandemic when Andrew Cuomo was a hero? Anyone who badmouthed him was considered a right-wing nut job. People were making and selling shirts like these 100% real ones that say, "I heart Cuomo," "I'm a Cuomo-sexual," and "A true American hero. Thank you, Mayor Cuomo." Andrew Cuomo was the governor of New York, by the way, not the mayor. That might be a clue to the intelligence level of the type of person who'd actually buy one of these shirts. Andrew Cuomo even won an Emmy for his, quote, masterful COVID-19 briefings. Of course, no one is claiming to be a Cuomo-sexual anymore, though. The former governor, not mayor, resigned in disgrace, and his Emmy was taken away from him after he was outed for allegedly sexually harassing multiple women. If this sounds like something straight out of House of Cards, that's because Kevin Spacey also had his Emmy taken away for being a sex creep. And if I were Andrew Cuomo, I'd be afraid of also being killed off screen before the start of the next season. Now, the only people who call themselves Cuomo-sexuals are probably felons. I'd say anyone who actually bought one of these shirts should rip them up and use them for cloth masks, but as we've learned, those are about as effective as an electric attack on a ground-type Pokemon. And while we are allowed to call out Cuomo for his policies that killed countless grandparents and how he tried covering up the full scope of that, sadly, he still hasn't faced any real consequences for that, and he may never. On the bright side, he's been ousted in disgrace, and the only shirts you're likely to see people buy and sell featuring Andrew Cuomo is this 100% real one that says, "Killing grannies and smacking fannies." Listen, many of these changes in the COVID narrative came as a result of our scientific understanding of the virus and situations evolving. That's just how science works. The problem is when the public health messaging is not allowed to also evolve because people don't want to admit they were wrong. It's like they think that admitting they were wrong will make people trust them less. What actually makes people trust you less is when you double down even when you know you're wrong. For all those people, I have a necklace I think they should be forced to wear. So what do you think about these things we used to be banned from saying, but now we can? Let us know in the comments below. And remember, America Uncovered is supported mainly by viewers. Be sure to visit patreon.com/AmericaUncovered. Contribute $1 or more per episode. We rely on your support to help us keep making great episodes. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.